this morning. My name is Lisa Dunnington and I'm one of the founding members of the People's Health Alliance. And I'm here today with my co-host Shirley Blanche and our inspirational. Can you hear me? Sorry. That's better. Our inspirational panellists as we discuss how we reclaim our health in the UK. For those of you who haven't come across the People's Health Alliance yet, we'd love to welcome you to the family. PHA was born in April 2022 when a small group of like-minded folk with a shared vision of empowering people to take back control of their health came together to build a network of hubs offering a holistic approach to healthcare with a focus on prevention and root cause healing. 3 years on, we've expanded our PHA community internationally, which shows us that this is a global vision shared by millions. Today, we are delighted to be here to launch our community action campaign, Connect the Dots. As you can see from the video, community means different things to different people, but as Jackie pointed out, community is everywhere, and only by coming together can we really spark change. So our job today is to inspire you to take action, something that can start with a simple conversation, but whose ripple effects can be far-reaching. Our goal is to empower you to transform your community one step at a time through connections made to create lasting health and well-being in the UK. So let's talk. This weekend you can find us in the marquee over there, along with PHA partners, the Conversation Starter Project, Stay Well It's Mental, I think Stephen's in the audience, National Residents Association, we've got Cassie here, and My Medical Choice. So please enjoy the panel discussion, and we'd like to include you all in that. There's going to be a Q&A at the end. But let's come together. Let's start building our communities again, because for too long we've been divided and separated and isolated, and we need to come back together and really make that change happen. So
Thanks everyone. It's really great to be here today. Thanks for coming along so early. We've got an amazing panel discussion today. We have got the wonderful Dr. Jenny Goodman, we have got the wonderful Cassie Langford, and Dr. Lisa Steele as well. And they've all got a different perception around how we can reclaim our health in the UK. It's really, really important, because I think that's the one thing that's bringing everybody together at the moment, is how do we reclaim our health? How do we take our power back? And so all of our panel have got different and unique ideas about how we do that together and how we connect the dots. So what we're going to do, if I can just grab the mic, I'm going to get each of them to introduce themselves. So for anybody that doesn't know them, you'll have a better idea at the end of this section, and I'm going to start with you, Jenny.
Hi, can you hear me?
No.
The mic's not
The tech, it's always the tech.
Yeah, it's always the tech.
Any tech people around?
Is it on the microphone?
Can you hear me anyway without the mic?
Yeah.
Right, okay. I
Hang on,
think we have
I think
to
we're there.
transcend
I
the
think we're
tech.
We had to transcend the tech. Okay, thank you very much. Okay, I think most of you know I'm a disillusioned doctor. Went to medical school a million years ago, wanting to learn how to heal the sick, how to prevent illness, and to learn what caused illness. Fast forward 6 years, they don't teach you any of that stuff. I've had to learn it since. And a lot of what I've learned is precisely about how everything is connected. The first 3 words in my latest book are everything is connected. And of course that also includes everyone is connected. So what I'm doing is making the links between the environmental crisis that everybody seems to know exists and the health crisis that many of you here know exists, but the vast majority of people out there don't know. Even though they know dozens of people with cancer, they don't know there's a health crisis. because it's become familiar, it's become normalised. It's not normal, it's not necessary, and we know what the root causes are. The root causes are appalling nutrition, the junk food industry, the pollution of our air, our water, our soil, and therefore our food, pollution of our minds, and the electromagnetic radiation and the nuclear radiation. We are very near Aldermaston here, which is all around us. So if we know who the enemy is, and we know what the enemy is, we can tackle these causes, but it is about community in the sense of making the links between the people who know. My particular concern is making the links between the farmers who grow the food and the people who eat the food. I'll maybe say more about that later.
Thank you. Okay, hi everyone. So I'm Cassie, and I started what we'd call the National Residents Association. And just to follow on from Jenny, I could see a massive disconnect with people in the awakened community, but also how do we reach the general public? Because I think sometimes this is the root cause of the problem, is the fact that we have been so disconnected for such an imperatively long time that is one of the fundamental things in order that we need to overcome. So I wanted to use a layman terms topic name, such as a residents association, because I knew it had power to reach the community itself, but number two, also to reach the councils, because the councils are rolling out all of the agendas that are at play today. So what I've gone and done is I've brought in some real life data that is UK government data, for people to see the radical rollout of solar, wind and battery storage units, and that's only just one. But anyway, with this, it's about taking the general public on a learning journey with us. And in order to do that, we have to reach them. So therefore, we need that vehicle in order to be able to, number one, reach them, and number two, show who thy enemy is, essentially. And that is what we've been doing all across the country. So with that, I'll pass you on. Thank you.
Morning, Lisa Steele. I run a holistic health clinic about half an hour from here, and have been in private practice because that's the only way you can be when you train outside the system. There are no other opportunities. And I've seen everything and been on this journey from a space where people were fairly ignorant of what was going on to a space where now suddenly people are starting to see something. They don't know what that is possibly. Some know a lot, some know a little bit. But I'm here to talk alongside my colleagues here to look at the role of our own personal health and how that relates to community and what can be done already on the back roll of things moving to make a very, very seismic shift into a new system. So that's my little journey today. Okay.
That's brilliant. Thank you so much. It's amazing. Thank you for giving your time today. We really do appreciate it. Jenny, I think if we can go back to you again, because you were talking a little bit about how we bring different sections of the community together, all working together for the same goal. So if I hand back over to you, and you can start talking about how we engage with the farmers and the nutrition and the environment, bringing it together.
So this is a festival about health, and there are many, many conferences about health that happen throughout the year. There are also many farming conferences that happen throughout the year. Like, the best are, there's Groundswell, there's Land Alive, there's the Oxford Real Farming Conference, which arose in response to the Oxford Farming Conference. So there are loads and loads of farmers with the awareness that they don't want to poison the soil, they don't want to destroy the soil, they want to go back to more traditional growing methods. And there are loads of us at places like this that want to reclaim our health, and who perhaps know that a few hundred years ago, before the Industrial Revolution, the healthcare person was our friend down the road. The wise woman, the witch, the healer, the herbalist, the midwife. Well, guess what? A lot of them got burned at the stake. So we all have to watch out. But we are trying to get back to that empowerment point, and it begins with knowing what our health results from. And it results first and foremost from what we eat, and what we eat is grown in the soil. So if it's missing from the soil, it's missing from your plate. So in other words, if you've had decades of intensive farming, that's taken all the nutrients out of the soil. And the very same nutrient deficiencies you find if you test the soil are the ones I find when I blood test patients, right? The zinc, the magnesium, the selenium, the chromium, the manganese, the iodine, they're all missing from the soil because of intensive farming. So they're missing from our bodies. That's what's missing. And then there's what's put on the soil. If the farm is not organic, then the plants are drenched with herbicides like glyphosate, it's not the only one, and pesticides, fungicides, herbicides, and so on. And the problem with these, and insecticides, the problem with these is they were originally developed as nerve gases used in both the world wars. And we have to know that history. So it's not surprising that they damage the nervous system and are very, very strongly implicated in Parkinson's disease, Alzheimer's, motor neuron disease, multiple sclerosis. They do that damage, and in my book I go into detail about the mechanism of how they do that damage. But the point is, that's what they were engineered to do. And they also cause cancer, and they also mess with our hormones. They're endocrine disruptors. Okay, that all sounds very grim, but actually, if you eat strictly organic, you are avoiding 95% of that. Now, it's 95, not 100, because we don't live in a perfect universe, so don't beat yourself up about trying to be perfect. If we do everything 80 to 90% right, for the vast majority of us, that will suffice. The other thing that intensive farming does is it puts synthetic fertilizers into the soil, and it's really ironic because they drain the fertility out of the soil and then they put back fertilizers which contain only phosphate and nitrogen and sometimes potassium. Now, I've never found any of those deficient in a patient, have you? That's not what we're missing. It makes the plants grow fast and tall but spindly with very weak cell walls, and they have no nourishment. And these farming methods are also eroding the soil, destroying the soil. It's washing away into the river with the synthetic fertilizers that then downstream cause algal bloom, right? And they destroy the oxygen, they destroy the fish and all the wildlife in the water. So what goes around comes around. We as consumers have the power to help break this vicious circle simply by supporting organic farmers, ideally our local organic farmer. Get an organic veg box delivered, and then not only are you eating food that is not poisoning you, you are helping the farmers who are refraining from poisoning the earth. And what I want to do, I'm beginning to do, is build links between organic, regenerative farms and their local communities. So you can buy your food at the farm gate, and that's just step one.
That's amazing. Thank you so much.
One historical note, I said the pesticides were developed from war gases. The synthetic fertilizers were developed from explosives. That's their origin. And you remember in August 2020, the explosion in Beirut? That was a storehouse of synthetic fertilizers. So they're still dangerous.
Thank you. That's so informative. That's brilliant. Thank you so much, Jenny. I think we'll go to Lisa now because we'll stay on the health side of things. So Lisa, you wanted to talk a little bit about what you're seeing in your clinic and some of the things that we can do in our community.
Yes, so just confirming what Jenny said there, downstream, I get those individuals that walk in who are afflicted by their environment. They don't know it, a lot of them. They have no idea that the symptoms that they are presenting with are linked to that environmental abuse, but they are. So our journey is to start to educate them on that information. So in order for people to understand that the root or one of the triggering pathways for their symptom picture relies in the environmental, we have to be able to demonstrate that and show that, which is what we start to do. But increasingly, what I'm seeing is that even the baseline education is missing. So in a world of TikTok and social media where people get so confused and misinformed, they come in with no strategy, no idea how to build back their health to a baseline even. And that is where I think we have to start to shift up and start to be more proactive. So there is no way you're going to be able to tell people how to get well, even with the knowledge that there are things that are affecting them. You have to involve them in that interactive process. And so for me, we don't want to be physicians or experts or guides who are telling people what to do based on this information that's around them. We want to engage them so that they are doing it themselves. Only when you learn how to fix the tap do you know how tap works. You can sit and watch a man or a woman teach you how to fix the tap and you'll observe it and know it, but you will not know it unless you do it yourself. So community for me is primarily about the education that starts the premise for people to want to know more, to want to get physically involved with things that they bring into themselves, so that when it's a dark day in the middle of November and people don't want to go out or can't go out or don't have enough money to be able to seek the advice, they can have enough information to stay from home and know how to survive and to hold their family community together minimally. So that's where I'm just going to pop that out there and then move on. Okay, who wants to grab it now? Do you want to talk about the general community?
So it's all about empowerment, isn't it, really? You know, so it's educating people so that they can be empowered over their own health. You know, that's a really important point. So it's great to have this, but how do we do it? How do we get out in the ground, in the community, and start to build this structure? And I think that's, Cassie, that's where you're doing such amazing work with the National Residents Association. So do you want to talk a little bit about that?
Yeah, thank you. Okay, so how do I put it? You've got to get people. People are so busy with their own lives that they just don't care unless they realise that they have a problem. So you won't capture somebody's attention until there is an issue. So I'll give you a couple of examples of that. I get calls from a variety of different topics from people all around the country. And, you know, you might hear somebody saying, I've got a new 5G tower going up in my area, and they're panicking because obviously they might be affected by EMF, so that affects that person. Or you might get a solar farm going up. I call this a pain point. The only time that people genuinely, authentically listen to you is when it impacts them. So let's just say if there is a new issue on the horizon, like I've got a group up in, and it's a very sad story, but I'll just give you a broad overview. They now are seeing people following children. There was a guy walking around with a knife and a machete and these kind of things. So now this community didn't know what to do. So they're feeling very disempowered, they're feeling weakened, etc. So that is a pain point right there, everyone. Or it could be any topic, whether they're feeling the cost of living, whatever. But it's how do you then go and reach them? If they don't know you exist, you can't reach them. So you have to work with your communities. We get people doing targeted leaflet drops, and it's so simple. We've stopped so many things and reached so many people by doing very simple exercises in order to reel the community in. That's the importance of having a vehicle where people feel supported, people feel contained, because when people feel unsafe, they act irrational. So that's one way of starting to reach the general public. And holding public meetings we found to be effective as well, and it's bringing back. Then it moves over to something about exposing thy enemy. So if you look at all the decisions that are being rolled out by the councils, for an example, but at a higher level we know that where that's really coming from, and then it gets rolled down to the governments, and then it comes down to the councils individually around the country to roll out the agenda. When you show people that the power lies within them, and that we're all working together, that's when things start to change. And I've seen that on quite a few occasions, but we need to amplify that more.
And it's hopeful.
It is.
Because I think that's really important, because I think the emotional aspect of this is really important, because how do you motivate people when people feel disempowered and disenfranchised from everything? And so what you're doing is providing a vehicle of hope.
Absolutely, but hope starts with all of us. It's not just one of us, it's all of us. But if we were all chipping away at our local areas, let's just say we had a branch in every town and city across this country, let's just say we did. What does that mean? If we can push back at reach people locally, but then obviously we've got that stronghold to go back to the councils. I'm working with now councillors that have made it into councils as well to strengthen our disposition of power. But if we had that as a national front, then we could push back nationally simultaneously at the same time.
That's really amazing. So I think we go back to Jenny again. How the work that you can see that Cassie's doing with the National Residents Association, can you see a way that that could fit in with your vision of connecting with farmers and other
absolutely,
stakeholders?
because it's all about education, and empowerment requires us to become much more confident in knowing what we know. And what I've been doing for many decades is demystifying medical science, making it accessible. Back in the 80s, when local councils were flourishing and adult education was a thing, I was teaching classes in Sheffield. In adult ed, ordinary working class women came along to learn what is alternative medicine, politics of health, women's health, all funded in those days by the university, the council, and if anyone's old enough to remember, the WEA, Workers' Education Association. And what I now realise is what I was teaching was quite radical. Obviously, there's a lot of stuff I didn't know, but what was radical about it was saying to people, when your GP prescribes you antibiotics and you have, pardon the pun, a gut feeling that that's not right, listen to your gut feeling. Your instinct is correct. Now here's the science that shows why it's correct. And what I learned very quickly is that ordinary people without even GCSE level or O level as it was then education are perfectly capable of understanding all this science if it is explained in plain English, which is why I've retired from clinical practice to write books in plain English. Because once we understand this, we can't be blindsided and blinded with pseudoscience by the medical establishment. So when you're saying this mask is damaging your health, obviously the person's GP will say, no, that's rubbish. But if we want to be able to stand our ground and say, actually, I have this information. So when I started working on the more recent book, I knew that pesticides made people dreadfully sick from clinical experience, blood testing, detoxifying them, which is perfectly possible. We can get these things out of people's bodies. They're lipophilic, they dissolve in fat. So they come out with saunas, they come out with phosphatidylcholine and good fats, many other relatively simple treatments. I just knew it from my clinical experience, but I thought, oh dear, can I back it up? Are there any studies confirming these links, for example, between pesticides and Parkinson's? And I need to put at least half a dozen of them in the book. Well, actually, the problem was, which of the tens of thousands of studies do I select? And this is the thing people need to know, that in proper PUCO, respectable, peer-reviewed medical journals that no doctors ever read, all the evidence for what you and I know is there. Right? There's no doubt about it. And the same with the EMFs. With the EMF chapter I discovered, again, there are tens of thousands of studies showing that, these cell phone towers and mobile phone use and Wi-Fi are linked with brain tumours and tumours of the throat and the salivary glands. The evidence is there. It's not hidden, it's just hiding in plain sight. And that's what we need to tell each other and tell everyone we know, because if you're trying to tell your friends about all this and they think you're just some renegade hippie, which hopefully we all are, but you say, look, here it is. Here's half a dozen studies from a proper medical journal. It's all there. And that, I think, is part of our empowerment. And again, the farmers. The thing about farming and medicine is we're both industries are up against the same issue, which is completely controlled by the chemical industry, the petrochemical industry, but increasingly containing vocal minorities who are saying, no, we want to get back to nature. We want natural medicine and natural farming. So that's why we have to be allies with the farmers, because it's the same battle.
I think Lisa just wanted to add something in there as well.
Yeah, I just want to say, if we look at the system that we have now become to rely on, what we have is a disparate set of things going on. We've been broken apart where we're meant to be together. And so people are struggling in isolation with all sorts of issues. in the days of when we all came from our tribes, we were in the bosom of our families. So nobody was tackling anything on their own. Whatever the situation was, there was always a backup, a network, a community. And this is what's been pulled apart over the years. This is what we have to reconstitute. And by that, we will be so much stronger. It's like any team, any network. But you look at where the suffering is, it's mostly people being lonely, stuck out on their own, no idea how to make decisions. They might be brilliant financiers, but they might not be good with their health, etc. So because we know, and you'll hear it time and time again in the festival, we know that we fix ourselves. So we know that. We know we have to rely on that because that's how it works. But sometimes we need a hand from the community to make that possible. And this is what this is all about on every level, from the farmer through the network of people working together, just normal people, regular people, and then people in the specifics of their health. The only way people are going to be learned to educate, to then be empowered to be able to self-heal is when that community gets together. And there are so many communities now coming together, and it needs to be joined, and then everything will change.
And this is why we need to connect the dots, bring everybody together, really important. So we're going to go to a Q&A in a minute. Did you want to add anything to that just before we do that?
Yes, I would like to. Just a couple little things. We try to simplify it for the in lay terms, essentially. So how do you reach the farmer? We've created a farmer's script so people can actually go and talk to their local farmer, or a letter. We have also done, I've done scripts for people to how to speak about 5G and a variety of different topics. It just really is reaching people in the best and quickest way. I did want to show today about the solar farms, and I do think it's extremely important. So we're just going to send some things around in the audience to show what we're up against, because if we don't understand what we are going up against, that is really sort of creating the problem. And like with 5G, we've got about 41,000 masts, so they sell us across this country, which is, I believe, it's about 1 in 2 people are getting cancer now. So whether that is all to do with 5G or not, so we have to understand what is coming against us in order why we need to come together very quickly to combat these issues. So on the slides, there's battery energy storage systems, there is solar farms, as well as wind turbines. And I just thought I'd send that around the audience to show the veracity of the rollout that's happening right now in real time. It's unprecedented. Do you want me to give a couple of examples? So so there's 7,000 acres that's going up, solar farm in Lincoln area. There's 10,000 acres of solar farm being applied for in Kent area. There is 60 wind turbines. So on average, a wind turbine consumes about 1,000 tons of concrete per wind turbine, and that's going across field of farming land and these kind of things. So on average, a farmer receives about 40,000 per hectare. £1,000 per hectare, but they're tying them into leases of about 40 years. So if you think about it from an environmental analysis assessment, what would that land look like after it's had solar, wind, or battery energy storage systems? Again, likewise, battery energy storage systems, people have no idea really what they are. So they are containers of shipping-sized containers of lithium-ion batteries. Now, back in 2020 in Liverpool, there was a fire, a highly explosive fire, and they're happening worldwide. So this rollout is happening across our country at an unprecedented rate. Applications are going in. We've also had an application going in near a primary school more recently. So what we've gone and done is the team up there have written to the head teacher and advise them about this, so that, and then we've written to the local press as well to try and create that pushback to stop it. So I just thought it was really, really important, and it's not to worry people, but it's an issue that we really do have to tackle, and that's why I wanted to show you guys. So thank you.
Information's power. So interesting. So we're going to go to Q&A now. So if anybody's got any questions, then please raise your hand and we will answer them for you. There's someone behind you with the mic. So just there. Thank you.
Hi. The alternative energy issue, are you just talking about the land use issue, or are you talking about EMF issues, or what's the issue with them?
What with renewable energy overall, or are we talking about it? Because 5G is completely separate from solar renewable energy problem. It's more about sort of showing the projected land use that they will be occupying for the duration of that time. So if you think about an environmental health analysis assessment, what would that land look like in 25 years' time if it's been having solar panels all whacked all over it? I mean, for an example, we could use alternative means and measures if we still needed solar energy, putting them on roofs and utilising office space, whatever we could utilise. We need to think of other ways. It's more about how much that is encroaching on our land space. What does that look like when I think I read yesterday that actually there was 1.5 million new homes are going to be built. So I think it said about 150 new large-scale residential schemes. So if we got more people and then we've got less land, and apparently we are only growing at the moment, and these figures are dating back to I think it's about 2023 the last time DEFRA reported on this, that we're only growing about 60% of our own food in this country. So then if we think about a global calamity that could happen and we became reliant solely on our food chain supply, what would that look like thereafter? If we've got all these renewable energy projects and now they're taking away the allotments as well.
Yeah,
so
that's shocking. Okay, that's brilliant. Thank you so much. Anybody else got a question?
Hi, thank you. Thank you for all you guys. It's phenomenal. I know I'm part of this to connect the dots, but I thought I knew a lot, but actually you come to a place like this and you realise there's so much more. We've got to keep learning. And so the question I want to ask each of you, a quick question. There's a lot of information to take on, isn't there? So if there's one thing, a takeaway from each of you that you could take away, what would it be?
Let's go, Lisa.
It can only be knowing enough to know how to turn the tide.
And if you can empower yourself, you can empower another. That's the one thing.
So my one tip is 3 tips. Eat organic, filter your water, and for God's sake, moderate your use of your mobile phone and learn how to use it safely.
And from me, doing nothing is not an option. It's not an option anymore. We have to do this and we have to do it together.
Anyone else got any questions? Okay, that lady over there.
Hello there, how are you doing? Sorry, I missed the beginning of the talk, but I work in housing in healthy homes, creating healthy homes, and I have an issue because, for instance, in the West London, we can't build that many new homes because there's not enough energy supply basically to be able to build this, because there's so many data centres in West London that are sucking all the power, and not only that, obviously overusing the amount of water. So do you have any insights around data centres and what we can do to push back against that?
Thank you. I'm so glad you brought that up. So at the present moment, we have 514 data centres across the UK, which, like you said, they're consuming electricity, water. It really is about taking it back for the smart city agenda, talking to people on a level that they can understand. So when you talk about how they're going to be utilising the land space, electricity bills we found for 5G, for an example, If I tell somebody that it costs 72 to 75 houses worth of power to fuel one monopole mast, people are not so overly keen on them then when they realise that they can't afford to pay their electricity bills. Does that make sense? So if we then, because I've got people talking to me about data centres, because I'm not sure how widespread they want to continue the rollout, but obviously to enhance their smart city agenda, they need to continually roll them out. Therefore, if we spoke to people and showed them things like with the graphs that I've been sending around in the audience, alongside with all of the other things that they're wanting to build, so their nuclear energy reactor centres, more data centres, etc., we have to show people from an energy consumption. I think that's probably the best route with regards to that, as well as how people can't afford things. So that's two things. I'm happy to have a chat with you.
Yeah, thank you. Lady over there.
Thank you. I come from Nottinghamshire, and so Mark, the bowler-hatted farmer, has been up talking round there. He's given some links, and I realise to some extent I need to take some control on this too, but there's very little information about organic farmers that people can access in Nottinghamshire. Because when I first got the link, I was saying to my friends, I'm going to pass this round all you, and then when I started to look, there wasn't much I could tell them. Obviously I should make some effort as well, and maybe go to a few local butchers or a few grocers that are left and ask them to make actual links. I mean, I know you get the standard organic boxes of standard companies around, but it also be quite good to actually go directly to farmers now. Do you have some links and also some recommendation of getting this all information together in a place that you can pass it on to people? Because as you say, everyone's busy and they don't have time to really do their research themselves. And I'm also a bit guilty of this as well. Thank you.
Yeah, this is a huge problem everywhere, and so what I've done is compiled a resource list for how to find your nearest organic and regenerative farmer, and it's mostly in the resource section in the very back of my book. And it means that wherever you live in the country, there are various websites that will say you put in your postcode and they'll tell you where your nearest local organic farm supplier is. So, I mean, you can get, like, Riverford will deliver to Nottinghamshire, but there will be local ones. But there are loads of wonderful websites that tell you how to find your nearest organic farmer. And like I said, they're a little bit in chapter 1, but mostly in the resources section at the back of the book.
And just to check, does that cover meat as well?
It certainly does.
Okay.
That's brilliant. Thank you very much.
So presumably you can't. Can you wait for the mic? Sorry.
Hi, thanks for all that. Just a curiosity question. It would seem that AI and other such things are going to drive energy consumption exponentially through the roof. Governments and corporations are not going to back off from that in any shape or form. And then we're hearing that nuclear, wind power, solar power, regenerative power, but obviously take up a huge effect as well. So my question is, what's the alternative to alternative energy?
What are we doing now is the question. Can we really afford to have this rollout when we're reducing how and where we can grow our food? This is the question that we need to ask ourselves. Now, when I did some research on it, it said that the main driver for the renewable energy saga, why we're doing this transition, is because we're at war with Russia. That's in government literature. I can't remember. I'm really sorry for I can't remember right now. Anyway, but that's what I read. So we would need to think about solutions to that problem. But like I mentioned before, if we put solar panels on houses, but what are we doing now? See, people are too quick to forget that we've been doing and having this electricity for many, many years, and now we're being told it's bad But is the new option, the so-called solution to this, is that really viable? That's the biggest question mark in the room. Can we afford to lose all of our land to then go and roll out all of these unprecedented solar farms? Especially if you're driving up the motorway now, you're seeing solar farm after solar farm after solar farm. But what people don't realise is that these applications are going on all over the country and they haven't been fully built yet. So it's a question, isn't it?
Your question is very important, and I think we have to acknowledge that we don't know the answer, because traditional fossil fuels are poisoning us and have been poisoning us since Dickens' time, and they really are lethal. But there are huge problems, as Cassie has pointed out, with the solar, particularly when they're taking off farmland, and with electric vehicles, by the way, because the batteries contain minerals that are, mined by enslaved children in the global south. And the wind farms make a lot of people ill because of the wavelength of the sound. And I don't think we've got the answer. I think you've said a part of the answer, which is vast amounts of energy are being wasted on computer technology and all this electronic stuff and 5G. And if you need a whole load of concrete for a wind farm, then that is also very energy intensive. So it's about trying to reduce the unnecessary usage. But I do think, we do need to get proper aware environmentalists working on this question, because we live in the Northern Hemisphere, it's not always August, and we do need to keep warm, and we haven't figured it out.
Well, I just say just one thing. If we diverted all the money that's being spent on all of this stuff that we know is not good for us and is toxic for us, that money would find a solution. Yeah. There are plenty of solutions out there. You've got some kids coming out of university with brainwaves, which will solve these issues, but they're not being brought to the fore. And we're in the quantum, and we know we're in the quantum. We talk all about this physical stuff, but in the quantum field, there are solutions for everything. It's just we don't know how to access it. So it's a diversion of the money that's spent, the billions and billions and billions of money that's spent and goes on spending in all these areas, which is just running up the wrong creek. We've got to change the creek, and then we've got to change our mindset to know that we can live incredibly and well. There's nothing, this is negative. There's nothing that's going to stop us other than our own minds, which will stop us.
I think there was a lady there that just had something she wanted to ask.
Sorry, this is on the back of the last question before last. If you live in an inner city and you don't have access to farmers markets, presumably the organic, local, grown in Britain supermarket produce is not the same thing as...
The problem with the organic stuff in supermarkets, even if it's got the Soil Association logo and so it is genuinely organic, it's better than nothing, but it's wrapped in plastic. And plastic is poisoning us as well as poisoning the fish, the birds, the rivers and everything else. There is nowhere in London where you cannot get a Riverford organic vegetable box delivered. There are organic veg box schemes all over the big cities, and there are also increasingly charities that are creating organic farmers markets in the poorest areas of our inner cities, precisely to supply people who couldn't afford a Riverford box. Again, the details are in the resources section of my book, but that is okay now. That is kind of getting sorted. If anyone's feeling overwhelmed, by the way, because it is overwhelming, isn't it? That's why we need community. We can only handle this information and formulate plans together. The only way to get it together is together.
That's brilliant. And also what we will do is we will add links to everybody's websites on all of our socials, and we'll be sharing it out through the PHA. So if you kind of come and follow the PHA, also come and chat to us in the community tent over there, we can sort of follow up on a lot of these things with you as well. So what I'm going to do now is I'm going to hand back to Lisa, because she wants to wrap up and say a few things.
Thank you very much, guys. I think you'll agree this has been I did want to just end on a positive note. The fact that we're all here together today and having these conversations are amazing. But I read something last week that really resonated with me, and it really embodies, I think, what Connect the Dots is. So I just wanted to share that with you. There's a massive change for the better happening on the planet right now. This change won't be on the news, and it hasn't gone viral. And if you don't look for it, you won't even notice it's happening. This change is quietly happening in the hearts of humanity. People are realizing that we become what we focus on, and we influence this reality based on who we become. So people are realizing that fighting is senseless and focusing on the chaos is futile. Rather, people are quietly focusing on creating their version of heaven on earth. They are healing themselves and focusing on creating more beauty. People have realized that awakening to their own divinity is what protects them from manipulation and allows them to become the change that they want to see. It's sweeping through the nations, but it's hard to notice. However, its strength is growing in numbers. Not strength in numbers to fight. Fighting only breeds more fighting. It's strength in numbers to create such a beautiful world that it will be obvious to others to join. To the point that one day they will hold a war and nobody will come. The frequencies of war, greed and manipulation will no longer be able to exist in a reality full of sovereign awakened beings living connected to their divinity. And I think that sums it up really. Actually makes me feel quite tearful. But it really is.